Wait, where'd you get that piano?
Have you ever thought about a world where a simple cut could be life-threatening? Where routine surgeries become too risky to perform? That world might be closer than we think. For decades, we rely on antibiotics to fight off bacterial infections, from a sore throat to something much more serious. But what happens when they stop working? Every time we misuse antibiotics, we give bacteria a chance to outsmart them. We're accidentally training them to become stronger, creating superbugs that are resistant to our best medicines. Imagine doctors telling you there's no effective treatment left. This isn't a scene from a movie. It's the growing reality of antimicrobial resistance. Over the next few minutes, we will explore what AMR is, why it matters, how it spreads, and most importantly, what we can do to protect antibiotics for the future. Imagine a world where antibiotics no longer work. Infection that used to be simple to treat, like urinary tract infection or a skin wound, could suddenly become life-threatening. Without effective antibiotics, even routine surgeries, childbirth, or cancer treatment would carry enormous risk. Modern medicine depends on antibiotics, and if they fail, the foundation of healthcare is shaken. Antibiotics are everywhere. They are prescribed in hospitals, clinics, and even used in agriculture. But misuse is common. People stop taking them too early, use them without prescription, or demand them for viral illnesses like the flu. Each misuse adds pressure on bacteria to evolve resistance. And because bacteria spread easily, AMR doesn't just affect individuals, it affects the entire communities.
So, what exactly is AMR? Simply put, it's when bacteria, virus, and fungi evolve so much that our current medicine no longer work on them. The infection becomes harder or even impossible to treat.
Antibiotics are powerful medicines. They work by targeting essential bacterial processes like building cell walls, making proteins, or copying DNA. When used correctly, they cure infection and prevent complications. But antibiotics are not magic bullets. They must be used responsibly because every dose creates pressure on bacteria to adapt. It's important to understand the difference between bacteria and virus. Bacteria are living cells that can survive and reproduce independently. Viruses, on the other hand, are much smaller and can only reproduce inside human cells. Antibiotics only work against bacteria. They cannot cure viral infection like the flu, the common cold, or COVID-19. Misusing antibiotics for viral illnesses is one of the fastest ways to drive resistance. Resistance develops in several ways. Random mutations in bacterial DNA can make them resistant. Bacteria can also share resistance genes with each other through a process called gene transfer. Some bacteria change the target site, so antibiotics can't bind. Others produce enzymes that destroy the drug. These strategies make bacteria stronger, and once resistance appears, it can spread rapidly. Resistance doesn't stay in one bacterium. Through horizontal gene transfer, bacteria can pass resistant genes to others, even across species. This means a harmless bacterium can share resistance with a harmful one, making infection much harder to treat. Another way resistance spread is through selection pressure. When antibiotics are used, they kill the susceptible bacteria, but resistant ones survive. These survivors then multiply and become dominant. Over time, repeated antibiotic use leaves only resistant bacteria in the body. This is why misuse, like taking antibiotics too often or stopping treatment too early, will accelerate the rise of resistant strains. Resistant bacteria spread easily between people and through the environment. In hospitals, they can move from patient to patient via unwashed hands or shared equipment. In communities, they spread through food, water, and poor sanitation. This means AMR is not just a medical issue. It's a public health and environmental issue too. Everyday actions contribute to AMR. Stopping antibiotics early gives bacteria a chance to survive and adapt. Taking antibiotics without a prescription means using them when they are not needed. Sharing antibiotics with others spread misuse further. These small mistakes repeated across millions of people and create a massive global problem. The impacts are serious. For patients, infections become harder to treat, illnesses last longer, and the risk of death increases. For hospitals, treatments become more complex, hospital stays are longer, and costs rise. For society, healthcare expenses increase and productivity is lost when people are too sick to work. AMR is not just a medical issue, it's an economic burden. The World Health Organization and the CDC recognize AMR as a major global health threat. Misuse of antibiotics in humans, animals, and agriculture fuels resistance. And because bacteria travel across borders through trade and travel, AMR is a worldwide problem. No country is safe unless all countries act together. Resistant infections are already rising. In the United States, so-called nightmare bacteria infections increased by 70% between 2019 and 2023. These bacteria resist multiple drugs and often require costly, intensive treatments. This is just one example of how AMR is making healthcare more dangerous and more expensive. AMR threatens global development. The World Bank warned that uncontrolled AMR could push millions into poverty, reduce global GDP by trillions of dollars, and severely affect food security. Low and middle-income countries are hit hardest, where healthcare access is limited and antibiotics are often misused. AMR is not just a health crisis, it's a social and economic crisis. Resistance doesn't stop with humans. Antibiotics used in farming enter soil and water, creating hotspots where resistant bacteria thrive. Poor sanitation and untreated sewage spread resistant bacteria into the environment. This cycle means AMR is also an environmental issue, affecting animals, ecosystem, and ultimately us. Although antimicrobial resistance can affect anyone, certain groups are especially vulnerable due to their health status or living conditions. Firstly, babies, particularly those born prematurely, have underdeveloped immune systems and are more susceptible to infections. Secondly, older adults, especially those aged 65 and above, often face weak immunity and frequent medical interventions, which increase their exposure to resistant bacteria. Moreover, people experiencing homelessness or living in crowded environments may lack access to proper hygiene and healthcare, making them more prone to infection and transmission. In addition, individuals with compromised immune system, such as those undergoing cancer treatment, living with HIV, or managing chronic illnesses, are less able to fight off infection effectively. Lastly, people who take antibiotics long-term, whether for chronic conditions or repeated infections, face a higher risk of developing resistance. This vulnerable population require extra attention, protection, and awareness to prevent the spread and impact of antibiotics-resistant infections. Prevention is possible. Use antibiotics only when prescribed. Always complete the full course. Never share or reuse antibiotics. Avoid using them for viral infections. And practice good hygiene like washing hands, cleaning surface, and preparing food safely. This is to prevent infections before they start. Each of us has a role. Follow your doctor's and pharmacist's instructions. Get vaccinated to reduce the risk of infections. Wash hands regularly and maintain cleanliness. And educate others about responsible antibiotic use. Small actions multiplied across millions of people can make a huge difference. Healthcare professionals must prescribe responsibly. Hospitals must strengthen infection control. Governments must regulate antibiotic use and invest in research for new treatments. Society as a whole must recognize AMR as a shared responsibility. Only through collective action can we protect antibiotics for the future.
Now, let's hear the voices of the public on the issues of antimicrobial resistance.
Jadi sekarang saya bersama dengan Cik Hana, Wawa, Cik Wawa. Okey, Cik Hana dan Cik Wawa. Sebelum tu saya terangkan dulu lah. Antimicrobial resistance di mana kita panggil juga AMR. Di mana situation tu bila kita ambil antibiotik, dia dah tak berkesan dah untuk rawat sakit kita. Itu secara ringkas lah pemahaman apa itu AMR. Jadi saya nak tanya dulu kepada Cik Hana. Pada pendapat Cik Hana, apakah langkah yang mudah yang boleh diambil untuk mencegah ataupun membantu mencegah masalah AMR?
Bagi pendapat saya lah, rasanya kalau kita rujuk doktor kan, kita boleh ambil doktor kan bagi instruction antibiotik tu. So kita kena ikutlah kata doktor tu, ambil daripada hari keberapa ke hari berapa. Dan kalau boleh memang kena pun ambil secara dia habis lah antibiotik tu, bagi habis ikut cakap doktor.
Tempoh yang dia bagi lah.
Tempoh yang dia bagi.
Terusnya saya tanya kepada Cik Wawa pula lah. Pada pendapat Cik, mengapa isu AMR ni penting untuk kita beri perhatian oleh masyarakat umum?
Sebabnya bagi saya, kalau kita tak peduli, risiko kematian akan meningkat. Penyakit yang ringan pun akan menjadi berbahaya seperti demam. Dan sakit perlu ubat yang lebih mahal dan tempoh yang lebih panjang untuk merawatnya.
Jadi itu saja.
Antibiotics are precious. They are the cornerstone of modern medicine. But if we misuse them, we risk losing them. Protecting antibiotics is not just about saving life today. It's about safeguarding healthcare for generations to come. Together, we can stop antimicrobial resistance from becoming the next global health catastrophe.